On this beautiful sunny day, Silver Cross Video Magazine is once again on the move. And today I'm at the Homer Glen Health Center, a gorgeous facility that opened in 2009. And I bet many of you have never been here. So come on in with me. I'll give you a tour and you can meet the crew. So now we're inside Homer Glen, and with me today are Maryanne Bedwell, who is the manager of Homer Glen, and Marybeth Antone, who is Administrative Director and also has oversight for this beautiful facility. So Maryanne, let's start with you.
Okay.
How long have you been at Silver Cross?
I've been with Silver for 20 years now.
20
20
years.
yeah.
Were you supposed to have the party this year?
I was.
You know what? We're doing another.
Are we? Oh, good.
We're going to do the 2020 and
Oh,
2021,
nice.
so
Yep.
you don't miss out.
I won't miss.
20 years. And what different roles have you had at the hospital?
I was in the main emergency room. That's where I started, and that's where I stayed. And then I came out here to Homer Glen about 10 years.
Thank you for all those
Thank
years
you.
of service. Yeah, you run a wonderful facility.
Thank you.
And how about you, Marybeth? How long have you been at Silver?
This December it will be 17. That's 17
One
years.
seven.
Yeah.
And you have many other responsibilities
I do.
besides Homer.
I do.
What
I
are
have
they?
I have responsibility for at the main campus. I have responsibility for all the procedural areas: surgery, endoscopy, the interventional cardiology labs, outpatient cardiology in general, and then I think that's it. That's it.
Well, that's a lot.
Yeah.
That's a lot. And you've recently taken on Homer
I
Glen
did.
as
I accepted
well.
responsibility for Homer in May, so I've been
Yeah.
working with Maryanne on that front, learning a lot.
And of course, everybody knows that Homer is one of my favorite places. I think that's well known. So what goes on here?
We have a very busy outpatient center. We do x-rays, MRIs, CT, ultrasound, and lab. And on the other side of the building, we have a freestanding emergency room.
Which is pretty amazing.
Yes.
How does that work?
It's a freestanding emergency room. We're an offshoot of the main hospital's main emergency room. We see all kinds of patients from a sprained ankle to a stroke.
Oh my goodness. And I believe we have, well, we'll go back there and take a look, but
Take a look.
it's a pretty special place.
It is a special place.
It is. So we're going to move on, and so you can see more about the center. So look who I found here at Homer Glen. Of course, Bantari Baskin, who's one of our great security guards. I know many of you know him from the hospital, but he also comes over here to Homer Glen.
And Matari, how long have you been with Silver Cross?
About 4.5 years.
Okay, great. And we're so happy to have you out here.
Thank you.
Thank you.
Likewise.
Yeah. And what do you see here? Like, what goes on here?
You know, being that this is an emergency room, you do get some interesting cases, just like at the main campus,
Yeah.
but not as much. It's a little more toned down. But you know, our job as public safety doesn't stop. We still have to provide safety for the campus wherever we are. And every once in a while, you do get an interesting case, but thank God that it gets handled and that it doesn't get too escalated.
Well, we feel very safe having you here. Thank you.
Thank you.
So welcome to the freestanding emergency center at Homer Glen. We have 6 patient bays here, which quite frankly right now are full. We have staff here 24/7, emergency room physician, registered nurses, and we also have ambulance techs that come and provide support to us here. Really busy place. We see patients 24/7, like I said, and if there's someone who's too sick to stay here, we do have the capability to transfer them to the hospital for advanced treatment, if at all possible.
Hi, let me show you. This is our outpatient draw area. We have a lab that's right next door and right down from our emergency room. We have techs here, the med techs here that draw the labs, and they actually run the lab here. So we have a lot of equipment and analyzers.
So let me introduce you to the Diagnostic Imaging crew here. We have Moyne, who does X-ray, and we have Deb, who does CT, and we have Denise, who runs the ultrasound. And Denise, you want to say a little bit about the team here?
It's a pleasure to work here. Everyone's always very friendly and accommodating, and I've enjoyed my years working here very much so, actually.
Absolutely. You guys just do a great job, and we want to thank you for that. Thank you. And Marybeth, I think we have something else here that's kind of big.
Yes, we do. Behind the closed doors is our MRI unit. We do MRIs here on an outpatient basis. The camera's really, really busy. We like to do those patients here because you're quickly in and out. And I do have to say that in this department, in the imaging area here, their customer satisfaction scores are through the roof.
Yes, they are.
We are a scaled down version of what we have at the hospital, but because we're small, we're a little bit more nimble, and we develop relationships with our patients because they come over and over again.
Right.
So great little department. You're in the center core of what they do here, but yeah, we're busy in MRI right now, so couldn't bring you back there.
Well, thank you.
Yeah.
Thank you. And again, this is just an amazing, amazing place. Great customer service. Lots of, diagnostics and ED, and upstairs there's a bunch of physician offices, but we won't be bothering them today. So thank you. Thanks all of you for a wonderful tour of this great facility.
Oh, thanks for coming here. We appreciate it.